It's important to understand when we go over the RN test plan and even the PN test plan that the NCLEX tests two categories. It tests the actual content of your material, everything you learned in school, and it tests your client needs. It tests your nursing actions, okay? So we got two categories, content and client needs.
For I know the plans I have for you, declares the Lord, plans to prosper you and not harm, plans for hope and a future. Jeremiah 29:11.
Okay, welcome to my channel. For those of you who are new, I'm your host and tutor, Annalise Garrison. And in this video, we're going to go over the RN test plan. Now, both the PN and the RN test plan will change March 2026. So this test plan here that you're listening to is in effect until March 2026. Now, we have four main categories that the NCLEX test for the RN NCLEX test plan. And that is safe and effective care environment. And under that, we have management of care and safety and infection control. The second category is health promotion and maintenance. Under that, we have nothing. It's just health promotion and maintenance. Then we have psychosocial integrity by itself. We have physiological integrity. And under physiological integrity, we have basic care and comfort, pharmacological and parental therapies, reduction of risk potential, and physiological adaptation. Now, as I mentioned in the beginning, the NCLEX tests two different types of things. It tests your actions, your client needs your actions, and it tests the content, what you learned in school. So let's keep all of this in mind as we go over the RN NCLEX test plan. So the first category of the NCLEX is the safe and effective care environment. This focuses on ensuring a secure and effective environment, not just for your clients, but for your healthcare workers as well. All right. So, don't forget some of your legal stuff will go into this too. Now, the management of care part, as far as the client needs goes, makes up 15 to 21% of the NCLEX. And the safety and infection control portion client needs wise, makes up 10 to 16%. Content wise, management of care will make up 18% of the NCLEX, and safety and infection control will make up 13% of the NCLEX. To explain that just a little bit further, the management of care deals with working with and coordinating care with other healthcare workers. Don't forget that, guys. Working with the multidisciplinary team is the way you will see it on the NCLEX, okay? And then the safety and infection control, that deals with high risk for falls, any safety measures. And of course, infection control is the airborne droplet contact precautions, right? So, client-wise, 15 to 21% care, safety and infection control, 10 to 16%, And content-wise, management of care, 18, safety and infection control, 13. All right, let's move to the next category. Health promotion and maintenance. Now, as you can imagine, health promotion and maintenance focuses on prevention, right? Think of like community nursing. Think of like routine doctor visits. Focuses on topics like growth and development, prevention, and strategies to optimize health. Now, client need wise, this would be 6 to 12%, and content wise, this is 9% of your NCLEX. Okay, the next category is psychosocial integrity. Now think about what that means. Psycho is your mind, social is society, right? So psychosocial integrity focuses on things like emotional, mental, and social well-being of your client. So any of your psych questions might fall into this. Cultural issues will fall into this. Some of your legal issues will fall into this. Anything that is psychosocial. Now, when it comes to client needs, 6 to 12% will make of the NCLEX will make this up, and the content distribution will be about 9%. So 9 to 12% of your NCLEX will be psychosocial. And lastly, we have our physiological integrity. Ladies and gentlemen, this is where the bulk of your questions are going to be. Your clinical judgment measurement model questions will be from this category. Now, let's talk about your clinical judgment measurement model. Now, this is something brand new with the NCLEX, and I will definitely teach you this when I teach you the critical thinking, when I tutor you with that. But this is true for both the NCLEX, PN, and RN. The clinical judgment measurement model will be tested by 18 test items using case studies, and those 3 case studies will consist of unfolding case studies. This is where all 6 questions will be tested in one question. The standalone case studies, which will make up 10% of the testing, and single case studies. Now, the standalone case studies, and I'll teach you more and go into more detail when I tutor you, consist of bow tie type test items where you have the potential problem, the parameter to be monitored, and the nursing action. You pick 5 things in one question, or the trending case study standalone where the scenario unfolds, different things happen in that one case study question, and you pick your answers depending on what's happening in that case study. So this is a very interesting and very new way of testing your critical thinking skills on the NCLEX. I actually like this. I think it's very easy. What makes it hard is you don't have the experience. This is why you need a tutor. And this is why I'm more than happy to tutor you. So under physiological integrity, client needs will be 6 to 12%. Content distribution is 9%. Now, what does basic care and comfort encompass? Well, it assesses the nurse's understanding of essential client care interventions related to comfort and movement. This includes like activities of daily living, hygiene, positioning, ambulation, and nutrition. This will all be covered under basic care and comfort. Basic care and comfort. Pharmacological and parental therapies, the client need will cover 13 to 19%. Distribution, as far as content goes, will cover 16% of your NCLEX. This will cover the essential knowledge of and skills related to medication administration, injections, and infusions. Okay, now don't forget also under your pharmacological and parental therapies, you have your herbs and your self-medication. Your vitamins and all that stuff, what people use to self-medicate. Don't forget to ask about that even after the NCLEX. We often forget to ask about ways people self-medicate with vitamins and herbs. Okay? Reduction of risk potential will make up, client need-wise, will make up 9 to 15% of the NCLEX. Content-wise, it'll be distributed. Approximately 12% of your exam will be reduction of risk potential, which would be identifying and mitigating potential risks to client safety and well-being. All right. This would encompass client safety, infection control, medical emergency, diagnostic procedures, medication administration, environmental hazards, and client education, right? The whole idea behind reduction of risk potential is for them not to get sick, to reduce those high risk factors. So this is why there's so much that encompasses this area of the NCLEX. And the last area in this category is the actual physiological adaptation. This assesses your ability to care for your clients experiencing physiological changes related to acute and chronic illnesses. This, I can guarantee you guys, this is going to be the hardest part. How do you care for a client that suddenly gets worse, right? Whether it's an acute illness or a chronic illness, right? Let's see. The different disease processes will be covered in this area, and so will injuries. And, this is like your actions. The NCLEX will be testing your actions as a nurse to respond to your client's change. So adaptation client need-wise will take up 11 to 17% of your NCLEX. I can guarantee you the clinical judgment measurement model, the case studies will probably be on the physiological adaptation. At any rate, the case studies will definitely be under the umbrella of the physiological integrity, that's for sure. And so the content of this area, the distribution content, will be at least 14%. So there you have it, beautiful souls. Here is your NCLEX RN test plan in a nutshell. 4 categories: safe and effective care environment, health promotion and maintenance, psychosocial integrity, and physiological integrity. Please write all this down. If you need help, please call today for a tutoring session, and don't forget to inquire about your free assessment. So your phone call might not even cost you anything. Please pick up the phone and give me a call and let me see how I can help you. God bless you, and don't forget to trust the Lord as you go into your NCLEX and take your exam. God bless, and I'll see you in the next video.